In this video, I want to talk about lumbar spine cardinal plane movement, so flexion, extension, your side bend, and rotation. And we're going to talk about how that relates to pain, to the hip joint, to the middle back, and sort of some of the structural and biomechanical considerations that I would think about when treating patients. So first, when something I do with everybody, even all the way up to shoulder, upper quarter stuff, down to foot and ankle, plantar fasciitis, I'm always looking at how the core is responding to movement and then what the lumbar spine is doing. So when I have someone go into forward flexion, I say, bring your feet together, or is whatever is most comfortable for you. And then I have them drop down and go down. I say, reach down as if you're going to touch your toes. So they go down, and I just want to see how they initially execute that movement, because there's a few different strategies that you can use. First of all, some people will choose to stick their hips back and sort of go into a hip hinge to then drop down, whereas other people will try to round down almost one level at a time. And there's no right or wrong to that different positioning. Both should be good. If I need to get down somewhere in a more confined space, I need that flexion through the back. Whereas if I'm going to pick up something heavy, then I need to use the hip hinge strategy of getting my glutes involved in the movement. So, and what that does during lumbar flexion, by going all the way down, what is slowing down that movement is going to be the entire posterior chain. So my glutes, hamstrings, all the way down into the calves, and then support from the lower back muscles coordinated with the core. So as I lower down here slowly, all of this starts to take up tension. Now, if that isn't flexible, or let's say I'm sensitive in my low back, either the myofascial or neural tension across the back of the body is going to perceive that slack and then let those pain signals or let the other proprioceptors and mechanoreceptors know about the perceived stretch or the increased signaling. So that's forward flexion. And that's really important for people who, they're going to come in and tell you that they have pain when they're doing X, Y, and Z, which might be some forward movements, it might be some backward movements. And we're trying to cluster together what movements hurt and then what those mean. So that's forward flexion. Their feet are likely still going to be together. Yes, you can try to do the most painful ones last. It depends how acute and how sensitive they are. Sometimes if they're that acute, you have to ask yourself, is doing cardinal plane motion on the first visit even necessary? So for the second one, feet all the way together again, core in, and we're going to do a back bend type movement. And as I cue this, I'll say, let me see you arch backwards to your back. And a lot of times, people's first movement is like that, where they arch back. And you can see that initial movement, it locks in the paraspinal muscles, compresses everything to the lower back. So then as they go back, they're like, oh, it hurts there, or it compresses a lot through the lumbar spine. A simple cue to see if it makes things feel better, and also to bring some awareness into low back extension. With the hands on the hips, if you press the hips forward as you arch back, then it opens up the front and you really see how the core is connected to the spinal mechanics. Whereas on the first one, you get a lot of compression through the lower back, and that compression is going to be picked up by the nociceptors and the mechanoreceptors that perceive mechanical loading. So if I arch back there first, right away it compresses. If I draw in and use the core and I get my hips forward, now I'm making space for the lumbar spine, and then it's not going to hurt nearly as much. So we're able to start loading a pattern without it being such a perceived pain. Eventually I want to be able to do both of those, but let's give ourselves as much room. Let's use as much other support around the spine as we can before kind of loading right into a painful pattern. So we have flexion, extension. For side bending, there's several different things I look for. So still standing with feet together, hands resting right by your sides. We just do one side at a time, and I say, I want you to take one hand and reach it down past your knee. And what I'm looking for here is, what's the relationship of this closing down to that opening up? And that's with all those movements. The same with the last one. It's what's the relationship with this opening versus that closing? So with side bend, as I drop over to the side, I want to see if my obliques can lengthen and help hold me up. I want to see how the hips shift over to then give more movement and stretch here, or maybe it's going to hurt on the left side and then compress right through here. And what it tells me is what's the extensibility or the flexibility of the lumbar spine as it's going through these side to side movements. Now, if someone is here and they say, oh, it hurts on this side, well, that means the body doesn't want to take compressive or loading stresses. If it hurts on that side, it means it doesn't want to open up and lengthen. So it's the balance of compression versus tension that we're always trying to manage. Oftentimes, it might hurt like on the compressive side, but more than likely, as they go here, they're then going to start shifting forward. So if I am going here, it's going to look like that sort of motion, where they go into flexion and side bending to try to open up that space. As I alluded to earlier, as someone goes over to the side, it should be a combined kind of lumbospinal or lumbopelvic movement of, as I go over here, the hip should deviate over that way. Here's my center of mass right there. So everything is staying in line as I go there, and then we want to compare it to the other side. Now for me, on the right side, I feel a little bit of compression or tension on this side. I still get some stretch, but as I load over that way, I can tell it doesn't want to do it as effectively. And how I would mobilize that on myself is then just kind of sort of working on different ranges of that pattern to get more compression without it hurting, and then also working on opening up here simultaneously. But I want to work into those ranges where it feels restricted as long as the mechanics are kind of set up how I want them to be. So flexion, extension, side bend, and lastly, we have rotation. And with rotation, I have them have their arms sort of wherever is comfortable. And initially, I just want to see what side to side lumbopelvic, or I mean, it's a whole body rotation. It's complete. I mean, we're getting, as I go here, the hip is relatively locked in internal rotation. The tibia goes into internal rotation. And then with my foot, I'm having to resist the roll to the outer foot. So I'm sort of controlling pronation, supination. But most importantly, I want to see like as I do that, how far do they go? So can you see the opposite shoulder coming through side to side? And like you can see here on the left, I have more. On the right, I have to work to get that. Well, that side bending, or the side bending from before that felt restricted there, matches the rotational tightness on that side. So as you're building a pattern, I have like more compressive feeling on the right side with side bending and rotation. So those things match up. Like I don't want to close down. I need to work on that. And what also then, because most likely people are then going to move in the patterns or move around those patterns that they don't want to move through. So, and on myself, I know like when I used to do lat pull down type movements, I would always compress on the right, and then I'd feel it in my hip flexor. So I'd compress there because I would try to gain stability by locking out versus holding core position in here. So not only are we building patterns, but we're looking for side to side symmetry. And then how does that relate to their symptoms, which is clustering all the information? Someone might say, hey, it hurts more in the morning, or it hurts after I do lat pull down movements, or it hurts after I sit for long periods of time. So how they move is going to tell you then what they're loading, what they're offloading, and then what sort of prolonged positions or other things sort of factor into their history of pain with movement. So lastly, we talked about the rotation part, but just one more time in review. As I rotate here, I'm looking to see how does the core move relative to the hips, and then what is the timing and the order of that? If right away, if I try to draw the hip back, so I deviate out of the plane of motion there, you're going to see that further down the chain. Whereas if I stay tall and then rotate through my core, you should see sort of a natural positioning of that and the core moving together. And it'll be almost like a 1-to-1 ratio of the hips will be moving back as the core moves back, but then because of the thoracic, it's going to look like more and more is happening. My check marks though are, as I go full rotation, I want to see the shoulder open up there, and then I even want to see the opposite shoulder turn through. So if 90 degrees is here, I want to see about a 100-degree turn throughout the entire spinal column. So look to see where they're leveraging motion, look to see where they're not getting motion, but trying to through other planes. And that is the cardinal plane assessment for the low back, flexion, extension, side bend, and rotation.